Hello everyone. In this session, I'm going to discuss properties of screening test. So basically, I will be discussing four important properties of any screening test. Its sensitivity, specificity, positive predictive value, negative predictive value. So I will explain you these terms, the differences between them, the formula of them, and how it is applicable in numericals. Actually, it is a very tough portion to understand, but it's very important, especially for the practicals also and theory also. So I will try my best to super simplify it. Let's start it. So let me tell you the properties of screening test. Let's start with the properties of screening test. Okay, so the four properties: sensitivity, specificity, positive predictive value, and negative predictive value. So for understanding, you have to understand this 2 into 2 column table, 2 into 2 table. Let me explain you. You have to draw this table as it is. Always on the top, take disease. Take disease present, disease absent, disease present, disease absent. On the left hand side, take the results of the screening test. We are performing screening test. So take the result positive, take result negative. What is screening test, by the way? So I hope you have watched the basic video of the screening test. So what is screening test? Screening test is a test which is performed on apparently healthy individual to get it diagnosed. Now in the community, there are two types of people, the healthy, the diseased. The diseased one will come to the doctor, to the physician by themselves. That doctor, I'm having some problem, some signs, some symptom, treat me. So we don't have to search them. They will come by themselves. We don't have to search. But we have to do active search among the healthy. The second class is the healthy. Now in the healthy individual, there are two types of healthy. The one which are real healthy. They don't have any disease, they don't have any symptom. But the one which are apparently healthy. What do you mean by apparently healthy? They think they are healthy, but actually they are not healthy. They think they are healthy because they don't have any signs and symptoms. So in the entire healthy group, they don't have signs, they don't have symptoms. None of them have signs and symptoms. But the real people real healthy actually don't have any disease, but the apparently healthy actually have disease inside them, but the disease is in subclinical phase. So now by performing screening test on them, we will give two types of results. If the screening test is negative, they are real healthy, right? They are healthy. And if the screening test is positive, they are diseased. So this is what I am writing the results here. The results of the screening test, whether it is positive or negative, right? Make the 4 column and write down A, B, C, D. This is A, this is B, this is C, this is D. Write down in the sequence only. Write down in the sequence only. So tell me what is A. What is A? So let me tell you what is A, B, C, D. Look at A. A are the individual who have the disease inside them and the test is also positive. Who have the disease inside them and screening test is positive. These are known as true positive. Actually, they are positive. So test is also positive and they have the disease also. Look at D. Look at D. They are actually negative. They don't have the disease. See, the disease is negative and the test result is also negative. So they don't have disease. The test result says, yeah, you don't have a disease. So it's fair. Okay, it's fair for them also. These are known as true negative. So actually they are negative. So it's fair for true positive and true negative. I mean to say, the true positive have the disease, the test results are positive in them, fair, okay. And the true negative, these are the individual who don't have the disease, so test results are negative. That's what we expect, okay. Now look at the other two categories, B and C. What about B? What do you think? Who are B? See, the disease is absent in them, but the test result is positive in them by mistake. The test result is positive in them by mistake. The disease is negative in them. Imagine an individual who don't have disease and you are convincing them to perform a screening test. You are performing the screening test on all of them. So he also participate in the screening test. He don't actually have disease, but by mistake the screening test is positive in them. So the person will get afraid. The person will have apprehension. Although we don't start treatment based on screening test, first we will confirm with diagnostic test, but there is wastage of time, money, energy. The person will go to the doctor, will perform diagnostic test, and if it is negative, we will neglect the result of the screening test. So these are the individuals who don't have any disease, but by mistake the results of the test, the screening test, by mistake it is positive. That's why known as false positive. These are not actual positive. By mistake the results are positive. They don't have actually the disease. Look at C. Who are C? The disease is present in them. They have the disease inside them, but screening test by mistake in them, it's negative. Imagine imagine a person who is having a disease in subclinical phase and he is performing screening test for that. The screening test is negative, so the person will be very happy. Oh yes, I don't have any disease. At that time, the person will be happy. But after some days, the disease will present with signs and symptoms. So on that day, the person will think, I have performed screening test also, but at that time, the screening test was negative. Then why I am having signs and symptoms now, right? So these are the false negative. the test results are negative, but actually they are not negative. The person is having the disease. So there are 4 categories: A, B, C, D. So see A, B, C, D. What is A, B, C, D? Say disease and say result. Result of the test. By result, I mean the test result of the screening is a screening test. So what is A? What is D? What is A and D? A, both things are positive. Both things are positive. Okay, let me make the column completely. These both, so they have the disease and the test says yes, you have the disease. So these are true positive. The D1, they don't have disease. The test also says yes, you don't have disease. The results are negative. So these are true negative. What about B and C? What about B and C? Let me tell you. The B are the individuals. These are false positive. So the test results are positive in them. Falsely positive, but actually they don't have the disease. These are false positive, and C are false negative. The C are false negative means the test results are negative in them, but actually the disease is present in them. That's why it's false negative. So false positive and false negative is basis on the test results, but these are false results. The test results say positive, but actually it's not positive. That's why false positive. The test result says negative, but actually it's not negative. That's why it's false negative. So please understand it very, very, very carefully. So you got it. So same, I can show you in the form of the graph. Can you see? This is the cutoff of my disease. A is the cutoff. A is the cutoff. The one who are below this cutoff, they are healthy. The one who are above this cutoff, they are diseased. Just suppose it is for blood pressure and I say the cutoff is 120/80. So the one who is having blood pressure less than 120/80, it's normal, and more than 120/80, it's abnormal, right? It's abnormal. Whatever is the cutoff, it's not necessarily blood pressure, whatever I can say. So this is my cutoff. So you will say these all individuals, see I'm marking with blue. So these all are below the cutoff. So these are healthy, 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 healthy. So this all is healthy up to this line. But a group of healthy is by mistake going to that side. It's by mistake. So these are false positive. Actually these are healthy. They don't have disease. But falsely they are positive. Falsely they are positive. They are going on that side of the cutoff. The same I'm marking with green now. See, these all are negative. They are above the cutoff. So this green, the complete green is above the cutoff. So these all are positive. These all are diseased. But can you see this portion? This portion, the test is giving negative, but actually they have the disease. So this is false negative. So in this graph, these one are the true negative. They don't have the disease. These are the true positive. They have the disease. Look at these two overlap section. So these one are the false negative. They are coming below the cutoff. And these one are false positive. They are coming above the cutoff. So that is the cutoff. You have to see the overlap section. You got my point? I guess you understand that. So this one is below the cutoff. That is false negative. This one is above the cutoff. That is false positive. You can understand. See, below the cutoff or above the cutoff. Below the cutoff is negative and above the cutoff is positive. That is a general rule. So that is the thing. You got my point? So this is the same table we will apply. I have already told you what is true positive, what is true negative, what is false positive, what is false negative. What is true positive? They have the disease and they are diagnosed as disease. So the disease is present and test result is also positive. What are true negative? They are healthy. They don't have disease. And the test results also say you are healthy. So test result is also negative. So people is healthy. Test result is also say you are healthy. Right? What are false positive? The test result says that you have the disease. The test result is positive, but actually the person is healthy. Actually the person is healthy. The person don't have the disease. These are false positive. What are false negative? The test results say that you are healthy. The person is healthy, don't have disease, but actually the person have the disease. I guess you can understand. The language may be different, the words may be different, but the meaning is same. I guess this 2 by 2 table is the best way to understand the 4 things: true positive, true negative, false positive, false negative. I guess it's crystal clear. You have to see 2 things: disease present or absent and test results positive or negative. Based on that, we classify in 4 categories. I guess you got it, right? The graph is also clear. Now let's start the chapter. Let's start first sensitivity and specificity. Then I will come on positive and negative predictive value. Let's start with sensitivity. Sensitivity is the ability of the test to detect true positive. What is true positive? You know who is true positive? This is the true positive. This is complete true positive. So among all the one who has the disease, how many have the disease? The disease is positive in how many? You will say, ma'am, A plus C. All complete A plus C, the disease is present, right? But among A plus C, the test is saying positive result only in A. C are the persons who have the disease, but test is not giving positive result in them. So it's the ability of the test to detect true positive among all diseased. Who are among all diseased? I repeat, please understand it carefully, slowly, carefully. Among all the diseased person, how many the test, ideally test should say positive to all of them. These all are disease, na? These, in all of them you can see the disease is present. You can see I am saying the disease is present in all of them. So A plus C, all of them are disease. So ideally the test should give positive result in all of them. But actually the test is giving positive result only in A, not in C. Only in A, not in C. You got my point? So it's A upon A plus C. That is ability of the test to detect the true positive among all positive. To detect the true positive among all diseased, I mean. Okay, so that is known as sensitivity. It is the ability of the test to correctly detect the true positive among all diseased person, among all sick person. The percentage who actually detect, the test is saying the positive. Okay, so that is A upon A plus C. That is the sensitivity. A upon A plus C. What is A? True positive. And what is C? False negative. So true positive upon true positive plus false negative. Don't try to learn this formula. You know what is ABCD now. You can anyways derive this formula on the spot only. Learn A upon A plus C, but don't change the sequence of ABCD. Then only these formulas are valid. This is sensitivity. Okay. For example, if I say sensitivity of any test is 90%. What do you mean by 90%? Sensitivity of a test is equal to 90%. It means that 90 upon 100. 90% means 90 upon 100. What is the formula of sensitivity? I told you it's A upon A plus C. I mean to say A is 90 or A plus C is 100. So A is 90 and A plus C is 100. So C is 10 obviously, right? So what is A? What is A? A is the true positive. And what is C? C is the false negative. So actually the sensitivity is 90% means if the test is performed on 100 individual, so out of the 100 diseased person, test will give positive result in 90 and in 10 of them, they have the disease, but by mistake the test will give negative result to them. So this is the meaning of this statement, right? So if I say sensitivity is 90%, you must understand this. So out of the 100 diseased people, total 100 are the diseased people, A plus C is 100. So total diseased people are 100. You can see here, total diseased people are 100, out of which A is 90. So that is the meaning of the sensitivity. Coming on specificity. Specificity is the ability of the test to detect true negative. Sensitivity was the ability of the test to detect true positive, and specificity is the ability of the test to detect true negative. I repeat, sensitivity is the ability to detect true positive among all diseased person. Specificity is the ability to detect true negative among all healthy person who don't have disease. Now ideally, who don't have disease? You say the disease is absent in B plus D. So test should give negative result in all of them. But test is actually giving negative result in D. In B, it is giving positive by mistake. You got my point? So it is D upon B plus D. You got my point? So it is the ability, it's D upon B plus D. That is true negative upon true negative plus false positive. You got my point? So what is sensitivity? What is specificity? So if you say the definition, sensitivity is the ability to detect, it's the ability to detect true positive and it's the ability to detect true negative. It's the ability to detect true positive among all diseased person and it's the ability to detect true negative among all healthy person. Okay, so what is true positive? True positive is A. And what is true negative? True negative is D. You know ABCD, right? Who are all diseased person? All diseased person are A plus C. And who are all healthy person? All healthy person are B plus D. So it's A upon A plus C and this one is D upon B plus D. So see the definition also, see the formula also, into 100 will be there everywhere. So this is the thing. You got my point? So here also you can see this is the sensitivity, ability to detect true positive, and this is the specificity, ability to detect true negative. Understand in the graph also. So understand definition also, understand in the graph also, understand formula also. If I say specificity of a test is 90%, what do you mean? I am saying specificity is equal to 90%. 90% means 90 upon 100. So what is 90? What is 100? So among the formula, B upon B plus D. So I mean to say B is 90. B is 90. Okay. And B plus D is 100. B plus D is 100 now. So D is 10. D is 10. D is, I'm sorry, it's D upon B plus D. So D is 90. D is 90 and B is 10. I'm sorry. Okay. So actually, specificity is 90%, it means the true negative are 90. So out of the 100 healthy individual, when the test is performed, out of the 90 the test will give negative result. The remaining 10 the test will give positive result by mistake. So that is the meaning of the specificity. I hope you got it. An ideal test should be 100% sensitive and 100% specific, but there is no ideal test in this world. There is no ideal test in this world. Please compare the formula of sensitivity, specificity in front of you, everyone. Sensitivity, ability to detect true positive among all diseased, and specificity, ability to detect true negative among all healthy. So its ability to detect true positive among all healthy, all diseased, its ability to detect true negative among all healthy. So this is all diseased person, this is all healthy person. So learn the formula. So if it is creating confusion in you, simply learn formula A upon A plus C, D upon B plus D. Don't change the sequence of ABCD. I am helping you again how to draw ABCD. So disease, present, absent. Let me draw a 2 by 2 column. Otherwise I get confused. Okay. So let me draw a 2 by 2 column for you. Okay, like this. So this is 2 by 2 column I am drawing. So here I will say disease, positive, negative. Here I will say test result. Test result always take on left hand side. Disease always take at the top. First positive, then negative. Here also first positive, then negative. Then say ABCD. So this is A, this is B, this is C, this is D. Always remember in A both should be positive. It's true positive. Always remember in D both should be negative. It's true negative. It's true negative. And B is false positive and C is false negative. If you can understand, it's good. If you can't understand, learn it. Now in that you can make out the formula of sensitivity and specificity. So sensitivity is A upon A plus C. Make it out. So that is true positive upon true positive plus false negative, and specificity is equal to D upon B plus D. That is true negative upon true negative plus false positive. So in this way you can learn the formula, you can understand the definition. So in the formula itself, one more thing I would like to highlight. You can see sensitivity. What is the formula? We will write it once again, the last time. I want to give you one more concept. A upon A plus C. And specificity, what is the formula? Once more. D upon B plus D. So can you say the same formulas in terms of true positive, true negative? This is true positive and true positive plus false negative. C is false negative. Here this one is sensitivity. And here specificity, it's true negative. D is true negative upon true negative plus false positive. I hope you got it. Now why I have written these again? You can see sensitivity is directly proportional to A, inversely proportional to C. Specificity is directly proportional to D, inversely proportional to B. So what I am writing, C, sensitivity is directly proportional to true positive, you can see it here, and inversely proportional to false negative. Inversely proportional to false negative. Instead of learning, understand in the formula. Otherwise if you try to mug up, everything will be volatile and you can't understand and you will do mistakes in the exam. So instead of learning, understand from the formula what is directly proportional, what is inversely proportional. So the main thing is the formula. If you know the formula, you can make it out. The specificity is directly proportional to true negative, that is D, and it is inversely proportional to false positive, that is B. So you can see it here. Instead of learning these 4 points, please see in the formula what is directly proportional and inversely proportional. So I repeat, sensitivity directly proportional to A, inversely to C, specificity directly proportional to D, inversely to B, and sensitivity, last thing, sensitivity and specificity are inversely proportional to each other. Never forget. If sensitivity is more, specificity will be less. If specificity is more, sensitivity will be less. Please understand. So that is the same thing. I tried to write it here. You can see here. So sensitivity and specificity, they are directly and inversely proportional to what you can understand from the formula, and sensitivity and specificity are inversely proportional to each other. You can check. So we are done with this. Let's come on positive and negative predictive value. Let's start positive predictive value first. So in the same table, I will tell you what is positive predictive value, what is negative predictive value. Okay. So positive predictive value is the ability of the test again to detect the true positive among all positive. So test is saying who is positive? Test is saying A plus B total positive. But among them, actual positive is A only, right? Actual, so it's A upon A plus B. Positive predictive value is A upon A plus B. Okay, and what is negative predictive value? Negative predictive value. So among all the test is saying negative to whom? Test is saying C and D both are negative, right? But actually negative is D. C is not negative. Actually, it is by mistake. So it's D upon C plus D. Please understand. You got my point. So that is the thing. You want me to say the 4 statements in Hindi? The students who understand Hindi, for them once only, right? The student who don't understand, I will say the same 4 statement in English. So let me first say in Hindi, then I will say the 4 statement in English. What I want to say is sensitivity, specificity, positive predictive value and negative predictive value. I want to say these 4 statements in English as well as Hindi. Please concentrate. Please concentrate everyone on the screen. It's very difficult. Let's start with sensitivity and specificity. Okay. Sensitivity क्या है? Sensitivity ability, क्षमता है एक स्क्रीनिंग टेस्ट की कि वो टोटल डिजीज में से ट्रू पॉजिटिव को कितना बता पाता है. टोटल डिजीज जिनमें है उनमें से ट्रू पॉजिटिव को डिटेक्ट कर पाता है कि नहीं, जिनको एक्चुअली डिजीज है. टोटल डिजीज में से एक्चुअली टेस्ट किन को पॉजिटिव बोल रहा है. सो इट इज A upon A plus C. A upon A plus C. It's the ability of the test to detect the positive, true positive among all diseased. Right? That is the sensitivity. Specificity उस टेस्ट की क्षमता है कि वो एक्चुअली टोटल हेल्दी में से ट्रू नेगेटिव कितनों को बता पाता है. एक्चुअली सभी हेल्दी हैं तो सबको ट्रू नेगेटिव बोलना चाहिए, बी और डी दोनों को बोलना चाहिए, लेकिन वो सिर्फ डी को ट्रू नेगेटिव बोल रहा है, बी को गलती से छोड़ देता है. सो इट इज डी अपॉन बी प्लस डी. Okay, it is the ability of the test to detect the true negative from all healthy individuals. ठीक है, ये बात तो हो गई, इतना तो समझ में आया. Okay, now coming on positive and negative predictive value. Positive predictive value again इस टेस्ट में कितनी क्षमता है कि टोटल वो जितनों को पॉजिटिव बोल रहा है उनमें से एक्चुअली डिजीज कितनों को है. टोटल वो जितनों को पॉजिटिव बोल रहा है टेस्ट, उनमें से एक्चुअली डिजीज कितनों को है. So it is A upon A plus B. That is positive predictive value. और negative predictive value जितनों को टेस्ट ने नेगेटिव बोला उसमें से एक्चुअली हेल्दी कितने हैं. सो इट इज D upon C plus D. So please see. So please mind the numerator. The numerator in sensitivity and positive predictive value is always A, and the numerator in specificity and negative predictive value is always D. The denominator is changing. Please, if you understand it, it's good. If you don't understand, learn the 4 formula. As simple as that. What is sensitivity? What is specificity? What is positive predictive value? What is negative predictive value? It's very easy. Sensitivity and positive predictive value, they detect the true positive, and specificity and negative predictive value, they detect the true negative. So here the numerator is A, here the numerator is D, because these both are for true negative, these both are for true positive. You know what is true positive, what is true negative. Now the denominator matters, the denominator. So what is the denominator in sensitivity and sensitivity? It's A plus C, here it's A plus B. Right? Here it's B plus D, here it's C plus D. You have to learn. I can't help. So I tried. If you can understand, it's good. If you don't understand, just mug the 4 formulas. Just mug. And you know which is true positive, which is true negative, which is false positive, which is false negative. You can create the formula like that. And if you can understand from the table, it's better. If you can understand from the table. So what is positive predictive value? It is the proportion of the patient with positive test who are correctly diagnosed. So among all the positive patients who actually have the disease. So A upon A plus B. A upon A plus B into 100. That is true positive upon true positive plus false positive. That is positive predictive value. And negative predictive value, it is the percentage of the healthy people among those who show negative results. So all those who are negative, among them how many are true negative? How many are healthy? I mean to say. So it's D upon C plus D. D upon C plus D, that is true negative upon true negative plus false negative. That is the thing. So please learn the 4 formulas. They are in front of you. Please, I request you to learn. So sensitivity, specificity, positive predictive value, negative predictive value. If you learn the formula on the spot, also you can make the definition. If you try to learn the definition now, you will get confused in the exam. So learn the formula. The best way to learn the formula. I told you how to learn that also. Into 100 is always there in all of them. In all of them, into 100 is there. So learn these formula in terms of ABCD and learn what is ABCD. So let me revise it quickly once for all, the final verdict. Okay. A, B, C, D. Who will tell me what is A, what is B, what is C, what is D? So A is true positive and D is true negative. Both things are positive, both things are negative. Okay. B is false positive and C is false negative. Never forget. If you understand from 2 by 2 table, it's good. If you don't understand, learn it. As simple as that. Now coming on the formulas. Let me tell you the formulas, the 4 formulas. Sensitivity, specificity, positive predictive value, negative predictive value. So among these 4, these 2, the sensitivity and positive predictive value, they both detect the true positive, so their numerator is A, right? And the remaining two, specificity and negative predictive value, they detect the true negative. That's why their numerator is always D. Now everything is the denominator. Who will tell me the denominator? What is the sensitivity? It's A plus C. And what is the specificity? It's B plus D, right? Specificity is B plus D, I'm sorry, it's B plus D here. What is positive predictive value? It's A plus B, and negative predictive value, it's C plus D. So please learn, please learn. Now in terms of these, you can always make it out, okay, and you can make the definitions also. The next thing, screening test in series and screening test in parallel. What do you mean by that? Series means one by one. So just suppose I am having two screening tests A and B. So first I am performing A, and some will be positive, some will be negative. So on all those who are positive, only on them I am performing B. So by doing so, what I am doing? I am increasing the specificity. So first perform test A, the result will be either positive and negative. The one who are positive perform B. And final, here also some will be positive, some will be negative. So the positive are considered only those who are both positive. The A is also positive, B is also positive. This is in series. By doing so, we are increasing the specificity but reducing the sensitivity, because sensitivity and specificity are inversely proportional. On the contrary, there is one more type of arrangement, that is in parallel. In parallel, we perform both the tests together, A plus B together. So here also there are four possibilities. Both are positive, both are negative. One of them is positive, one of them is negative. Even if one is positive, either this is positive or this is positive, consider total as positive. So by doing so, we are increasing the sensitivity, but we are reducing the specificity. So in series, we are performing one by one. So by doing so, we are increasing the specificity, and in parallel, we are performing them together. By doing so, we are increasing the sensitivity. So parallel increases sensitivity and series increases specificity. The other quantity will automatically reduce, because we know sensitivity and specificity are inversely proportional to each other. Are you getting it, or is it bouncer to you? You got it? I tried. So what is series? What is parallel? In series, the tests are applied one after the other. The second test is applied only on those individuals who are positive for the first, and we will consider positive if both are positive. By doing so, we increases the specificity, and in parallel we are applying all the tests together. So if any one of them is positive, we will consider it together. So there are many options. Now maybe this is positive, maybe all of them are positive. So here by doing so, we are increasing the sensitivity. So please learn what we are increasing. The other quantity will automatically reduce. If specificity is reduced, automatically sensitivity will fall. Now if sensitivity is increasing, automatically specificity will fall. Don't learn the other quantity, learn the conclusion. What is the conclusion? The conclusion is that in series, specificity increases, and in parallel, sensitivity increases. What is increasing? Learn that. The other quantity will reduce. That's it. We are done. We will solve some MCQs based on that. The first question is in front of you. False negative means. What do you mean by false negative? False negative are, the test is saying negative. The test is saying they are negative, they are healthy, but actually they have disease in them. They are false negative. They are not real, true negative. So the person who have the disease but show negative test results. Yes, I guess this is the correct answer. Okay, if you have the concept, you can make it out. The next is, what is the numerator of sensitivity? The numerator of sensitivity is always A. That is true positive, right? And if I change the question, instead of sensitivity, if I ask you specificity, what is the numerator of specificity? It's always D. That is true negative. So in that case, answer will become C. The next question is in front of you. The diagnostic power of a test to correctly exclude the disease. Exclude the disease. I mean, the diagnostic power of a test to exclude the disease means they want to detect the true negative. So what do you say? Is it sensitivity, specificity, positive predictive value, or negative predictive value? So of course, it is negative predictive value that can make it out true negative. That is D upon C plus D. Among all healthy, it is a diagnostic power to detect the true negative. That is negative predictive value. Now we will solve one numerical based on these. See the question. In this question, I will help you how to make this table. Please try to learn this table. Once the values of ABCD are there, you know the formula, you will apply, the answer will be in front of you. So just learn how to make this table. This table making is ultra important. So in this table making, always we take disease at the top, disease positive, disease negative, and always we take the test result on the left hand corner. The test result positive, test result negative. So write down A, B, C, D. Now first do this homework and then read the question and make the try to take the values of ABCD out. Reading the question. First make this table. Always in exam also make this empty table and make fill in the blanks A, B, C, D. And now give me the values of ABCD by reading the question. Read the question. A test for hepatitis C is performed for 200 patients. The test for hepatitis C is performed with for 200 patients with biopsy proven disease. So 200 patients have disease and 200 patients known to be free of disease. So 200 patients are there who is having biopsy proven disease. So disease is positive in them, and another 200 patients are there which is free of disease. So tell me, what are these 200? What is the value ABCD? So disease present in whom? Disease absent in whom? Disease present in A plus C. So this is complete 200. In 200 disease is present, biopsy proven disease present in 200, and another 200 in which free of disease. So all the person who are free of disease, B plus D, it's also 200. So till now I got this information. Now read the question again and make it out. Okay, the test shows positive results on 180 of the patient with disease. Among the disease, the test is positive in 180. Among the diseased, who are diseased? A plus C is the disease. Among them, the test is positive in 180. The test is positive, that is A is 180. So obviously C is 20. No need to say, it is not written, but common sense, I can make it out. C is 20. Now read more question. And negative results on 150. The 150 are the negative results among the patient without disease. So among the patient without disease, the negative result is in 150. So obviously B is 50. So once the value of ABCD are out, so A is 180, B is 50, C is 20, and D is 150. Yes, I'm right. Yes, I'm right, right? Total 200, total 200. Once the values are out, you know the formula. You know the 4 formulas: sensitivity, specificity, positive predictive value, negative predictive value. Please apply all 4 formulas. Do the calculation. I'm not interested in mathematics. Please apply ABCD. The values are in front of you. You know the formula. Apply the formula. See what is correct. So the mathematical portion will be easy. So just apply the formula for all 4. One of the option will be correct. I'm not interested in calculations. I'm interested in this approach, how to make this table. Reading the question. They will not give you direct values of ABCD. They will give you either total diseased and total healthy person, or they will give you total test positive and total test negative. Then they will give you one quantity of ABCD, the remaining quantity from the total. By deducing from the total, you have to make it out. I guess you are getting what I am saying. So practice such more questions. They can come in your practicals also, right? So that's all about it. Have a look on the university exam questions. They can ask you, what is sensitivity, what is specificity, positive predictive value, negative predictive value, differentiate sensitivity, specificity, differentiate positive predictive value and negative predictive value. So you can, I guess, write all of them, write the definition, write the formula, explain the difference, and always draw 2 into 2 column table. Always in that table only you have to explain. That's all about it. I hope you enjoyed, you learned. Thank you.
Hello everyone. I hope you found this concept clear and easy to understand. If you had liked to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLive by Dr. Priyanka. So, join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.